This video was designed to guide you in using the accuvein AV300 vein illumination device, which can assist in locating certain peripheral veins for IV starts, blood draws, and other procedures where vein visualization is indicated. The simple-to-use AV300 adds sight to the venipuncture procedure. This addition to your current vascular assessment can have a positive impact on both the caregiver's and the patient's experience with venipuncture. You can watch the entire guide for a complete overview of best practices, or you can jump to any section listed in the browser for help with a specific question. Before using the device, remember to read and understand both the operating guide and the user manual that are available for download on our website, and can also be found on the DVD that comes with the AV300. The AV300 is very easy to use and can improve the venipuncture experience for both the caregiver and patient. Accuvein recommends that the AV300 be charged so that the battery power level indicator displays at least one bar in the upper right-hand corner of the LCD screen. To begin, simply power the device by pressing the blue button on the side for half a second. This will activate the vein display light. To turn off only the vein display light, press the blue button for a half a second. This will leave the device on to perform menu functions, which you'll hear more about in Chapter 7. To turn the power off, simply press the round power button under the LCD screen, or press and hold the blue button for 2 seconds or until the device shuts down. The AV300 can be used during assessment and cannulation. An easy way to remember the basic operating steps of the AV300 is the acronym PASS. P. Press the blue button to activate the vein display. A. Assess the veins in your patient. S. Select the best vein to perform your procedure. S. Start your procedure. Next, we will discuss assessing a patient's vasculature. You can familiarize yourself with the proper operation of the AV300 by using the practice card provided in the box and with the training DVD. The best results are achieved if you remember the 3 rights: right height, right angle, and right setting. Hold the device approximately 7 to 12 inches or 18 to 30 centimeters above the surface of the card. If you fit the projection within the brackets on the card, you are at the right height. If you are holding the AV300 properly, you will see a line run through the projection that is a simulated vein. Always position the AV300 directly over your subject's veins, holding the device at a right angle or perpendicular to the direction of the vein flow. Rotate the AV300 back and forth, and you will see the simulated vein appear and disappear. This is the right angle. There are several settings that affect vein display. While viewing the simulated vein, lightly tap the blue button to test each setting and see how they affect the projection. When you are using the AV300 on a patient, a useful technique is to click through the settings a few times while you scan a patient to find the one that works best on that particular patient. S, followed by a number, will appear on the menu screen to indicate which setting you are on. The same setting may present veins differently from one person to the next, so it is important to focus on what you see on the skin rather than what's on the display. Practice with the card until you become familiar with the concepts of right height, right angle, and right setting. Remember, while in most patients the veins will run in the direction you expect them to, there is quite a bit of variation from patient to patient. Take your time as you scan the patient, changing the angle and height, as this will help you locate more target sites. You can also adjust the lighting in your exam room to help better see the vein display. Please note that while depending on the distance the AV300 is held from the patient's skin, the vein may appear slightly wider or narrower than the actual vein, but the center line will remain accurate. The patient will generally have the most prominent veins in the dominant arm, so start scanning with the AV300 on that arm. If you are unable to locate veins in this arm, the other arm should be examined. The AV300, used in conjunction with standard venipuncture techniques, can help you visualize additional veins. As many of these techniques require both hands, it may be helpful to place the AV300 in one of our hands-free options prior to proceeding. To locate a vein while the AV300 is illuminating the area, palpate by pushing down on the skin with the tip of the index finger. Using a tourniquet while you scan can also help show more veins. Massaging the arm from wrist to elbow or wrapping a warm wet towel around the arm or hand for a few minutes can help make veins visible to the AV300 as well. Another useful technique is to add tension to the area being visualized. This aids the system by thinning out the area being scanned. This may be simply using a finger to press against the skin or bending the wrist or ankle. While scanning, you can confirm that you have located a vein by using a wiping motion to occlude return. Press on the skin distal from the heart and wipe proximal to the heart. This empties the vein lumen. When you release, if you are viewing a vein, you will see the vein refill. The AV300 can also come in handy during those infrequent occasions that a venipuncture will need to be performed on the saphenous vein. It is important to remember that in some patients, veins may be too deep or too small for even the AV300 to find. The absence of detectable veins is useful information. It can help you decide if you should escalate before making multiple attempts to cannulate the vein. This can avoid unnecessary patient pain and trauma, as well as save valuable time. The next chapter will take you through a complete venipuncture procedure, demonstrating an IV start with the use of the AV300. As stated earlier in the video, the basic operating steps involved in using the AV300 for a venipuncture procedure is the acronym PASS. P. Press the blue button to activate the vein display. A. Assess the veins. S. Select the best vein. And S. Start your procedure. Once you have turned on the device, you can assess the patient's vasculature. The AV300 can be placed in one of the various hands-free options that allow both hands to be free to perform the procedure either when assessing the veins or when the best vein has been selected. A tourniquet is placed on the arm. This can also be applied earlier while assessing the vasculature if additional help seeing veins is needed. The venipuncture site is then cleaned. This wiping will also occlude return and the vein will refill. It is important to note that virtually all standard operating procedures state that to avoid contamination, once the site is cleaned, you cannot palpate the site again. In the absence of being able to repalpate, the AV300 helps to re-verify vein positioning after cleaning. After the site has been cleaned, the vein can be accessed. When using a syringe, a flash of blood in the syringe hub indicates that the vein has been successfully entered. The tourniquet can then be removed. We will now discuss the various hands-free options in detail in the next chapter. The AV300 quickly converts from handheld to hands-free with various hands-free options. Accuvein offers both an unpowered solution that relies on battery power and a powered one that can charge the device while in use. They can be clamped onto a nearby object such as a bed rail, table, chair arm, or IV pole. There is also a wheeled hands-free stand available. The device operates in the same way whether you are holding it or using the powered or unpowered hands-free accessory. To use the powered or unpowered options, first attach the clamp or screw-mounted stud in your desired location. Once securely mounted, snap the hands-free coupler onto the stud and press the black ring down to lock. The arm should swivel freely. To connect the device to the hands-free arm, ease it into the cup with the LCD screen facing up. The clips will snap into the recesses on both sides of the AV300, and you will hear it click into place. To remove the AV300 from the cup, hold both clips while pushing the unit up and out of the cup. The battery indicator will let you know how much available power is left. A flashing yellow or red indicator notifies you to immediately recharge the battery. When not in use, the AV300 should be stored in its charging cradle or powered hands-free arm so that you always know where it is. It will always have a proper charge and be ready for use whenever you need it. In addition, the lithium-ion battery in the AV300 will last longer if it is kept charged. Full discharge followed by recharging will shorten battery life. An empty battery will take about 2 hours to fully charge and will then provide about 360 viewing procedures. When properly maintained, the battery will last for several years. Longer charge cycles, shorter operating periods, or a bad battery alert are all indications that the battery needs replacing. You can check the charge of a battery when it is not installed in a device by inserting and pressing a paper clip into the small hole in the battery casing. A green light indicates there is at least 30 minutes of operation time remaining. If the green light does not illuminate, the battery should be placed in a unit and charged. In order to tailor the AV300 for individual users and types of procedures, you can make configuration changes by pressing the left LCD button. This will display the settings menu on the LCD screen. There is a full range of settings that can be adjusted to customize the AV300. Default settings are useful to select the favorite vein display setting that is initially active when the AV300 is powered on. To change the default vein display setting, go to Settings, Device, View Settings. Use the right arrow and checkmark buttons to select a new default setting. If the vein display light is on but no buttons have been pressed for 5 minutes, the vein display light will automatically turn off. To change or disable the vein display timeout interval, go to Settings, Device, Timeout. Then press the left and right arrows to set the timeout between 1 and 55 minutes, or to 0 to disable the vein display timeout. To save battery power, the AV300 is also automatically configured to turn itself off 5 minutes after the vein display light has been turned off and no buttons are pressed. If the AV300 is in a powered hands-free stand, the device must be manually turned off. The LCD backlight can be dimmed or brightened. Go to Settings, Device, Backlight. Choose the desired brightness. To save the setting, select the right checkmark button by pressing the button underneath. The AV300 beeps to announce certain events, such as a low battery or warning screen, or when different functions are activated, such as when you save a setting. The volume setting for the notifications can be adjusted or turned off by going to Settings, Device, Volume. Individual AV300 devices can be labeled with the name of a department or of an individual user. There is a maximum of 14 letters. This can be helpful to organizations in keeping track of or distinguishing between multiple AV300s. To do this, go to Settings, User, Name. Use the up and down arrows to select the correct letter, and press the green check mark to move to the next character. When finished, save the name by selecting Save and pressing the green check mark. Selecting Clear will delete the device name. The device name can also be set using the AV300 PC application, which can be downloaded from the support section of the accuvein website. To change the language, go to Settings, Device, Language to change or review the current language. Languages are displayed in their native alphabet, and the current language is highlighted with a check mark. Use the up and down arrows to scroll to your desired language and press the green check mark to select that language and exit the screen. You may escape the menu without changing a setting by pressing the blue button. A system reset option can return an AV300 to its initial factory settings. Press and hold the middle and then left LCD buttons simultaneously to display the system reset screen. To cancel the reset, press the left button to return to the start screen. To reset the device, select the green check mark. In order to maximize your use of the accuvein AV300, proper care and cleaning are important. To clean the body of the device, the charging cradle, or hands-free accessories, you may use standard hospital disinfectants and wipes. Consult the user manual for a full list of approved cleaning solutions. The optical surfaces on the bottom of the AV300 should only be cleaned with a soft lens wipe with several drops of 70% isopropyl alcohol placed directly on the wipe. A pre-moistened alcohol prep pad used for cleaning the venipuncture site can also be used. Slightly damp whites are optimal, as it is important to avoid getting excess liquid inside the LCD screen and with optical surfaces. Allow the unit and optical surfaces to dry before use. Dirt or scratches on the vein display light window will show up as shadows in the vein projection. You will be able to distinguish the shadows caused by dirt or scratches because they will move with the projection. Remember, when not in use, the AV300 should be stored in its charging cradle, which will extend battery life, making it easier to find so that it will always be ready to use. Proper operation of the accuvein AV300 will ensure its safe and successful use. The AV300 does not require any calibration or testing. It is designed to detect situations in which it cannot operate properly and will automatically turn off the vein projection light and display a fault or a warning screen. One special set of warnings is for hot or cold temperatures. The AV300 is designed to work with a range of approximately 5 to 40 degrees Celsius or 41 to 104 degrees Fahrenheit. A warning screen is displayed when the unit goes outside of this range. Should this occur, simply move the unit back into an appropriate environment to allow it to return to room temperature before using it again. The AV300 can be operated in colder or hotter settings for short periods of time. For example, an AV300 that has been kept in a room temperature environment can be used outside for 10 or so minutes even if it is hotter or colder, since it takes some time for the AV300 to heat or cool. However, leaving the AV300 for extended periods at temperatures outside the specified range, such as overnight in a parked vehicle, is not recommended. Should a fault warning occur, press the round button to turn the unit off. Then press the blue button to start scanning. If the warning repeats, turn the unit off and place it in a charger at room temperature for at least an hour. If the warning persists, please call accuvein technical support. It is important to remember never to shine the vein display light in your or your patient's eyes. For patients such as neonates or those under anesthesia who have inhibited or reduced blink reflexes, or if attempting a venipuncture procedure of the scalp, Accuvein recommends outfitting the subject with a protective eye shield. Consult the user manual for recommended eye shield options. Thank you for viewing this video. When properly used, the accuvein AV300 can make IV starts and blood draws less stressful for both the patient and the caregiver. For further information or for answers to any additional questions you may have, please contact our technical support team at 816-997-9400. This video is intended to demonstrate the use of the AV300. Wherever demonstration techniques shown in this video differ from your medical training or procedures approved by your medical institution, you should follow your institution's approved procedures. The AV300 is not intended to replace professional judgment and training in selecting venipuncture sites and performing procedures. Users should read the user manual prior to use of the AV300.